Welcome everyone to the Utah League of Cities and Towns Economic Impact of COVID-19 Town Hall. This has been our regular tradition for the last few months, and it's a tradition. While it's nice to see everyone on a regular basis, it's certainly a tradition that I think we all hope ends at some point. But today we are thrilled to be joined not just by local experts, but also by national stakeholders as we tackle the next steps of the COVID-19 crisis. I'm Cameron Dill, the Executive Director of the Utah League of Cities and Towns, and we're going to have three different segments of our Economic Impact Town Hall today. The first segment will be the Federal Advocacy Update, and instead of just having the conversation with League staff and with members of Utah's delegation, we've invited some heavy hitters from around the country who are in this fight with us, and to give you an update on what's going on from their perspective. The second part of the town hall will be an update from the Utah Hospital Association around ICU capacity and the Mask Up Utah campaign. And then third will be an opportunity to discuss the implementation of the CARES Act with the ever-changing guidance from the Treasury Department and also some feedback we've received from the federal delegation about the CARES Act. So with that, let's start on the Federal Advocacy Update. And we are thrilled today to be joined by colleagues from both the National League of Cities and the U.S. Conference of Mayors. And for all intents and purposes, this is Team City. We are all on Team City here as we seek federal partnership. Our first speaker will be Clarence Anthony, who is the CEO and Executive Director of the National League of Cities. He's joined by his colleague Angelina Panettiere, who is leading up the federal advocacy efforts by NLC. Then we will have Mayor Jeff Williams of Arlington, Texas, and Mayor Nan Whaley of Dayton, Ohio, who are the co-chairs of the U.S. Conference of Mayors effort advocating on this topic. And Mayor Williams is also the chair of the Metro Economies, their subgroup at the U.S. Conference of Mayors. So with that, Clarence, I'm going to turn the time over to you. It is great to see you, and it's great to serve on your board. I'm the first Utahn in a while to serve on the National League of Cities Board of Directors, and it's been an honor and a privilege, and I picked an extraordinary time to be part of the board. So take it away, sir.
Well, thank you very much, Cameron, and we're just honored to have you on our board and the Utah League as active as it has been the last 5 or so years. So thank you all so much for your leadership. You know, I was reading and I found where you guys approved this Love, Listen, and Learn plan. And I got to tell you, I just think that that's amazing in this time that you are so revolutionary given some of the things that we are dealing with in America right now. First, let me thank your president, President Mendenhall, for inviting me and providing the National League of Cities as well as the U.S. Conference of Mayors this time to just talk about what is going on and what is needed for cities at this time. You know, we've been working hard for the CARES Act, and we've been trying to make sure that money gets to where it's meant to be, and that's at the local level. And back in May, when we saw that Congress provided only a limited amount of money, direct funding, to fewer than 40 cities in America, that's when we launched our Cities Are Essential campaign. Everybody should be able to get direct dollars. Every city, town, and village should be able to get direct dollars. And you all have been working very hard with us at the National League of Cities to help bring money home to our cities, towns, and villages. I'll also talk about, a little bit about what we're facing as it relates to the racial upheavals in America and the discussion related to systemic racism and institutional racism. It does not matter whether you are from the Northeast, Southeast, West, Midwest. This issue is at the forefront of America right now. And when you think about the COVID-19 pandemic, all it did was to lift up the fact that there is this gap in America in regards to opportunity. And at the National League of Cities, we're continuing to work on that issue, providing resources so that leaders are able to manage and lead during intense times. Also, to be able to share information so that you'll be able to, as a leader, be a healer and be the person that your citizens are looking to help resolve and manage the challenges that are going on in your community. And then we're looking at financial struggles, the recession. We're looking at cities having to cut and furlough employees. Mayor Whaley had to do that in her city. We're looking at cities having to cut services. So this is the time for us as municipal leaders to, one, love each other and talk about how we feel about each other and how we engage each other. The other part is the listen part. This is a time that we've never seen before, and it provides us with an opportunity to listen to our citizens, listen to each other as municipal officials, but also listen about the issues that we're being challenged with, and not judge, but listen. And finally, to learn. And I know that all of us through this call, these virtual town hall meetings, the information that the National League of Cities is sending you on a daily basis, that you in fact are learning. So thank you all so much. We're continuing to work with our Cities Are Essential campaign. And I'm going to introduce the quarterback of our campaign, since there's not going to be any football this year. The quarterback of our campaign.
Simmer down, Clarence. Some of us are still holding out hope.
None. Angelina Peniteri of our federal advocacy team. Angelina?
Thank you, Clarence. As Clarence mentioned, I'm Angelina Panettiere. I'm a legislative manager here at the National League of Cities. And as Clarence framed up for you, it's really now or never to influence Congress. And this is our last best shot to get real aid for localities for the foreseeable future. And I'll just echo, the Utah League of Cities and Towns has done an amazing job on behalf of all of our communities. So today I'll talk about our legislative goals for this summer, why this month, the month of July, is so key for our efforts, and how you can best help support it. One other thing that I will add up front is that even if your city is not in dire financial straits right now, I would really encourage you to consider what your financial picture might look like in a year or two, and how you can be an ally for communities around the country right now. Because what we learned in the 2008 financial crisis was that the recession, which is different from this one has been very severe and very fast, had a long tail for communities. And while some city budgets saw a delayed impact from the crisis because of their revenue mix, it was deep and it was long lasting. And in addition, local governments got nowhere near the level of support that they needed from the federal government to deal with the fallout in terms of housing, joblessness, and all of the increased needs in their communities. So we have learned from that experience, and we know that we need to act swiftly and decisively this time to get real partnership and assistance from the federal government so that we can prevent a similar scenario or worse from playing out in our communities. And we also suspect that the longer this crisis goes on, the harder it will be to get assistance from Congress, which has already appropriated huge amounts of money and is increasingly reluctant to do more than that. We can't afford to wait around another year and then go back to Washington with our hats in hand. We have to make the case for local government right now. So now we're down to the final stretch of this effort. Congress is going to return to Washington next Monday, and they have an enormous amount of work to do in a very short period of time. In addition to an upcoming August recess, this year's fall legislative work period is really short because of the upcoming election. And Congress also has to take care of defense reauthorization, surface transportation reauthorization, and the fiscal year appropriations deadline. And in a normal year without a pandemic and an election, that would be a lot for them to accomplish. But this is not a normal year, and many of members of Congress are also very focused on the presidential election, the conventions, and their own re-election campaigns on top of pandemic response. And there are a lot of competing priorities and stakeholders for pandemic relief. So if we don't make the case for cities, nobody else is going to do it for us, and we are going to be left out. But on a brighter note, we're making real progress. We've been pushing nonstop for months now for substantial additional direct federal aid that is fairly and appropriately allocated to local governments of all sizes without a population floor. We've been pushing for flexible use of that money to address everything from public health and economic recovery to addressing serious shortfalls in municipal budgets. And stressing that while that flexibility is important, merely adding flexibility to the existing coronavirus relief fund from the CARES Act is not enough. We need dedicated additional funding directly to localities because, as we've seen so far, using the states as intermediaries and governors as our decision makers has not been a winning bet for local governments. The states have their own budgetary problems to solve. We have to focus on making sure that we get money to cities. So that is where you and all of us come in. We need our local officials to keep the pressure on legislators and generate a sense of urgency so that Congress understands that they can't go into recess without completing this work. And we're asking everyone to call your legislators over the next couple of weeks, bring in your city budget staff, and brief them on the details about what kinds of hard choices you're making locally and what your city is facing financially, so that they know that there are real numbers behind what NLC and the Utah League have been asking for. And we've put a guide on how to put that meeting together, what information to cover, and a way to tell us how it went so that we can follow up. And I am happy to share that with the league staff and put that in the chat box once I'm done speaking. But there's a place here for everyone. If you've already held a detailed meeting like that, please let us know how it went. And consider spotlighting the asks and the conversations that you've had in your local media. And if you can't hold a briefing, you don't have those details, please at least use our talking points to call your senators and make the case to them privately that we need their support. Even if you've spoken to them in the last few months, there is no such thing as over communication right now. They need to be hearing from you regularly. And we're also more than happy to help support your effort by pointing you to NLC's research that we've done about the economic harm that's occurring on a national level, as well as how direct federal aid can help stabilize the economy. And I would also add, specifically, given how supportive Senator Romney has been in his conversations with you so far, I would really encourage you to ask him to press his colleagues in the Senate to act on local aid. A number of his fellow senators who sit on the Finance Committee are in a real position of influence over this legislation. For example, Senator Crapo in Idaho, and some of them are on the fence. And the opinion of their peers is really important in issues like this. So with that, I know we're on a tight timeline, so I'll wrap it up. But if you have any questions or additional information you want to share, please contact us at advocacy@nlc.org. And you can also find all of our Cities Are Essential resources online at nlc.org/cities are essential.
Terrific. Thank you, Angelina. And one thing I'll add here as a reminder to our members who are participating in this call is that the League Board of Directors took a unanimous position in support of a fourth stimulus bill. And the primary principles that we have been sharing with the delegation revolve around what Angelina just stated: direct allocation to cities and towns of all sizes. Because of the 249 cities and towns in Utah, exactly 0 have a population above 500,000. So all of our cities were subject to the state of Utah or to 2 counties. And the good news is that we've successfully lobbied those entities to share some of those dollars with cities and towns, but we don't want to be in that position going forward. And then the second key principle is that principle of flexibility, which I'll also add another word to it, which is clarity. Flexibility with the clarity of, so that we understand everyone's on the same page of how the money can be spent. When Wayne takes over later in the broadcast, that's caused no end of questions over the last few months, particularly with how the Treasury Department keeps shifting sands on us. In our conversations with most of our delegation, they've been very responsive to learning about what's happening at city halls around the state. So they're hearing from us as league staff. They need to hear from mayors and council members and city managers from around Utah. And not just around Utah, but from around the country. And so I want to thank again Mayor Whaley and Mayor Williams for joining us. Mayor Whaley, let's start with you. I must say before we start that I was very disappointed to not get to see Dayton in the NCAA tournament because of COVID-19, as I'm sure you and the entire Dayton economy was bummed about that. But talk to us about what the U.S. Conference of Mayors is doing, and then Mayor Williams, after she finishes, we'll turn it over to you.
Cameron, thank you for that nice plug about the Dayton Flyers, who, in my mind, have won the NCAA tournament since it did not occur. And we were ranked very high. It's a very big basketball town, and so thank you for that comment. Hey, I'm really excited to be here and excited to be working with the League. The U.S. Conference of Mayors has a campaign as well. Clarence mentioned cities are essential. Ours is a little more about the time. It is called July or Bust for money. And so we are working really, really hard over this next week and 2 weeks, these next couple of weeks, to really make sure that our senators know that we need funding for our communities. And in a town like Dayton that is not above the threshold like all Utah cities, we did not receive direct funding, and we need funding that is direct and that can be used for revenue loss. And my city, we're expecting cuts of around $13 million. It's about 8% overall just this year. And this stuff is going on for a while. So we really, really need you all to reach out. And again, thank Senator Romney. Encourage, as Angelina said, to talk to other senators and talk to the entire delegation about it. Secondly, we have the U.S. Chamber of Commerce, who agrees with us that cities need this funding. Please reach out to your business leaders. Have them write a letter with you of support. Let these senators and congressmen know that your businesses agree your cities need this funding. It's not just about making sure we have the essential services. It's also about making sure this recovery doesn't happen so slowly. If cities aren't part of the recovery, it will be much slower. I want to thank our executive director, Tom Cochran, who's also on this call. It is a pleasure to get to lead this effort with my partner over here from Arlington, Texas, Republican Jeff Williams. This is a bipartisan effort for us because we know the majority of Americans are with their cities, but we have to do the work of making sure that we engage our business community so they talk to our senators and congressmen. Call. This is the last effort for this year, and do this in solidarity with all of us to make sure that we get the funding we need to put the frontline workers first and take care of life-saving services in our community, but also that we don't hold up the recovery. Can I kick it over to my dear friend, the awesome mayor of Arlington, Texas, Jeff Williams?
Absolutely. Mayor Williams, take it away.
You're muted, Jeff.
Mayor Wiley, thank you very much. This is a real key time for us to be able to move out to really help cities across America, because unless we are on our feet, we're not going to be able to lead in the economic recovery. In Texas, we have made an all hands on deck push there with Senator Cornyn, which is our senior Republican senator. We actually have got him to the point where he does say that the revenue loss from cities is direct result of the coronavirus, and certainly it is. We also have been pushing very hard from the fact that we can actually quantify that revenue loss that we have. This isn't for pension plans. It's not for frivolous programs. This is for us to be able to move. And of course, one of the biggest economic engines in America are our cities. And without us, we cannot get to where we need to be. Some of the things that we have done is we have brought together not just our 15 largest cities, but also with them, we have combined all sizes of cities. We have written letters, and we had a very effective letter in which we put together in 2 days 111 signatures of mayors from cities of all sizes, and it did get the attention there of our congressional delegation, including Senator Cornyn. We have another one about to go out, but we have combined both our mayors and our business leaders to make the calls there to us. But right now we are on a real big hunt for other Republican senators and to shore up our Democratic senators, so that we have others that will be there to be able to withstand the push from Washington politicos when they get back, because they've got to remember what is going on at home. And so, as Nan mentioned, and Angelina, Clarence, now is our time to make these calls before the senators go back. And in fact, tomorrow I have another Zoom call with Senator Cornyn in a one-on-one there just to remind him, because we know there's going to be a lot of pressure. In addition to that, we have got to stand together and be willing now in July to do what we can do, because Angelina said one of the most important things. We do not know how long this is going to last. Myself, I have a AAA bond rating in our city. We have reserves, but yet we don't know how long this pandemic is going to last, nor do we know how far-reaching the economic impacts are going to be. And we need this help so we can rebound quicker and to be able to lead out there and really get the economy going, because we know a big part of the health of America is to get the economy back on its feet. So thank you very much for the time here, and we look forward to making this happen in July, or so we do not bust, right, Mayor Whaley?
That's right, Mayor Williams. So feel free. We'll put some efforts as well in the chat. We have a press effort that you can, press toolbox that you can use in the next week. Share what your community's thinking and what they would go through in the next year should this money not come. And then please, please, please reach out to your business community, as the U.S. Chamber of Commerce is with us, and let your senators know that as well. Cameron, thanks so much for this time. On behalf of our president, Greg Fisher, and our CEO, Tom Cochran, Mayor Williams and I are very grateful for all the work you guys are doing in Utah as we continue our July or Bust campaign. Thanks.
Perfect. Well, thank you both, and to the National League of Cities and the U.S. Conference of Mayors. Like I said, in this case, it's all team city. And Mayor Whaley, you mentioned that this is a bipartisan effort. Everything at the city level is not a bipartisan effort. It's a nonpartisan effort, because we're all in this together. But Mayor Williams, appreciate your perspective as a Republican mayor and talking about targeting Republican members of Congress, because 5 of the 6 members of Utah's delegation are Republicans. And so that's helpful insight about the approach you're taking in Texas, so that we can replicate that here. As an update for those listening on the call, we did send another follow-up letter to each of the members of the delegation, as well as followed up individually with their senior staff. Wayne and I actually chatted personally with Congressman Curtis last week, and so we've been making sure to relay that information. We've shared the Doug McDonald data that we shared broadly in the town hall a few weeks ago about the sales tax and gas tax impacts on cities. So we urge you in the days ahead, emphasize that cities are essential and that it's July or bust to get this message across to the delegation. So friends at the U.S. Conference of Mayors, National League of Cities, thank you very much for your time this afternoon.
Thank you.
Thank you, Cameron. Have a great day.
Perfect, thanks. Terrific. Well, we'll come back to the issue of federal advocacy in a moment when we talk about the next steps on the CARES Act. But before we get to that, we wanted to talk about the urgency of the moment, because in addition to lobbying Congress this summer, we've also seen some really alarming impacts from COVID-19 with case counts, fatality rates, and impacts on hospitals. And so we invited Greg Bell, who's the CEO of the Utah Hospital Association, to join us today to give us an important update on the status of all of those essential items. And the one thing I need to say, Greg, before I turn it over to you, is that while you've worn many public titles in your career, now with the Hospital Association, previously Lieutenant Governor, previously State Senator, the public title that we all know is most important is that you are once a mayor, always a mayor. So Greg, thanks for joining us, and I'll turn it over to you to give us an update of where things are in the hospitals around the state.
Thank you. I'm delighted to be here, Cameron, and I have such a fond feeling for our mayors and municipal officials in the Utah League. As Governor Herbert says, local government is where the rubber meets the road, and we all know that to be true, and it's ever more so now with issues of social justice and conflict with police and typical public safety activities. It's a place and a theme that none of us have really confronted before like we have now, and your jobs are so difficult but so important, and thanks to you for for being in the middle and trying to find common ground here. It's not an easy issue. It's certainly not an easy place for you. I appreciate the time to just discuss with you. I won't spend a lot of time on presentation, but I did want to just share with you a few, we don't see enough charts, right? So first of all, let me just show you, this is the case count. Remember when we really got scared in April and May, then we came out of essentially what was a lockdown on May 15th. Then we had Memorial Day, and we were thinking we were pretty cool. And then right after Memorial Day, we've had this launch. And so we went from 150 cases to 250 to 300, 350. And now over the last week or 10 days, we're average, the 7-day average is about 650 cases. Now, some of these spikes occur because of reporting, but that's where we are, 650 cases on average per day. Here's a heat map showing that this is an equal opportunity disease. Salt Lake County actually is held very steady. Cache was anomalous to some degree, as was Millard, because of outbreaks in meatpacking plants or common facilities. Unfortunately, San Juan County has had another outbreak because of an infection spread in a skilled nursing facility. And so we had here big numbers for a small county, which reflected the outbreak on the Navajo reservation. And now we have this, in the last few days, this terrible outbreak among probably an elderly and disabled population. Here is a harbinger of bad news. This is the percent positive of our cases. So on the 24th of June, we were approaching 10% positive. During the salad days, during April and March, we again were self-congratulatory because our testing rate was around 4.3%, lower than the national average. But that has doubled till now. We are at an average of 9.9% for the last 2 weeks and about 6-something% all time. So our percent positivity is starting to overwhelm us. Well, you just have to ask yourself, what can you do? What are the tools we possess to interdict this terrible infection? How do we stop its spread? We know that economic shutdowns are quite effective. When we send people home and say you can't communicate with others and you can only go out for a limited purpose, then the disease is spread very slowly and rarely. But we, in that process, of course, seriously damage our economy, and we've hurt businesses irretrievably in some regards, small business, particularly restaurants. A huge percentage may never come back. So none of us wants to do that again, least of all the politicians. So we've been looking for the science. Well, what is it that we can do? And the single most effective thing, absent absolute isolation, is to have a very vigorous social distancing, personal hygiene, and masking program. Goldman Sachs says that in their own study, they've studied East Asian countries, with a national mandate, we could raise the percentage of people who wear masks by 15 percentage points and cut the daily growth rate of confirmed cases by 1 percentage point to 0.6. Let me just pause at that point and tell you that what we track is the infection rate. In other words, for every case, how many other people does an infected person infect? If it's more than one, then you have growth by definition. If an affected person has an infection rate of 1.2, then obviously that grows over time. Our infection rate has grown to be about 1.4, which means that we're doubling our cases every 5 to 10 days. So if you have 650 cases a day, and we think there are about 2.5 times as many untested, so let's just say that's 2,000 cases a day times 7 is 14,000. So if that's our rate this week, 14,000 next week is 28,000, the next week is 56,000. Obviously, very quickly, you run out of hospital and other capacity to deal with these illnesses. The Goldman Sachs calculations imply that a face mask mandate would potentially substitute for lockdowns that otherwise would subtract nearly 5% from GDP. So we are of the opinion, backed by worldwide research, that rather than shutting down the economy, if we have a mask mandate, we can avoid a 5% deduction from our GDP. So let me just show you our campaign here. So 3 weeks ago, the hospitals financed a public service campaign called Mask Up Utah, hashtag Mask Up Utah. I do it for my mom, and we have lots of assets and materials that we're sharing with various groups. I do it for my friends. I do it for my kids. And then we have various logos, Mask Up Utah, etc. So that's what we're pursuing. We had a press conference about 3 weeks ago pushing this point, and then we had a further press conference Friday. And each of the medical leaders from Intermountain, the University of Utah, Steward Healthcare, and Mountain Star Healthcare, each of their chief medical officers addressed the public and urged the governor to adopt the mandatory mask rule. Now, we understand this is very political and divisive. It's not divisive in Korea or Canada or in other places where masking has been very, very successful, but it is among us. Don't tread on me. You know, we believe in personal freedom, and people don't want to have their personal freedoms abridged. But I think you all understand the logic of wearing a mask to protect others, and research is now showing that wearing a mask even provides some protection for you, up to 40%. If Cameron and I speak within 6 feet of each other without masks, the risk of infection is extremely high. If I'm wearing a mask, then his risk of infection falls to around 40 or 50%. If he wears a mask, our mutual, and I do too, our mutual risk of infection falls into the single digits. So it may be unpleasant, it may feel like it impinges on your freedom, but wear a mask, and we urge each of the cities to become engaged in this, because if you want to protect your citizens and your economy, this is by far the best way to do it.
Thank you, Greg. As you pointed out, this has been politically charged as of late. And last week, the governor made the announcement that he would require masks in schools and in state facilities, but he was stopping short, to use his term, of a statewide mask mandate, but that he was supportive of local leaders who requested the authority to have mask mandates, which has occurred now in 1 town and in 3 counties. This morning, I was on a call with Speaker Wilson and President Adams, where they were talking about masks and this Mask Up Utah campaign and the next steps. So what do you expect over the next couple of weeks? And what would you like to see from mayors and council members around the Mask Up Utah effort?
Well, there's no question that this disease has been somewhat geographical. It just, as you saw on the heat map, Rich County doesn't have any. Emory County right now has, or never has had any cases. So I understand Paiute County, Wayne County, Kane County, etc. Some of those folks feel like, why are we having to deal with urban problems? You can argue both sides of that. But clearly the most practical approach to this would be a statewide mandate. It's been shown in Korea, for example, Taiwan, Hong Kong, and Okinawa, that because of pollution, because of SARS, avian, H1N1, those people have been used to wearing masks. They have virtually nailed this virus because they wear masks and it's socially acceptable and something they expect to do. So our number one request would be to ask the governor to make this a mandate. If you don't agree with that, or that doesn't happen, and frankly, I think the governor is getting close to that. It's just that the legislature is extremely leery of doing it. Then I would ask as a city that the governor allow you that authority to do that. One of the complications we're finding, and Mayor Mendenhall knows this, is that if you're in an orange status, then that starts to affect your schools. And all of a sudden, your schools under Utah Leads Together with an orange color are barred from in-person teaching. And let me tell you, that gets mothers excited really, really quickly. So there is that little wrinkle, but if we don't have a statewide mandate, then I would urge you to ask for a local one.
In the call this morning with the president and the speaker, there was back and forth around the ICU capacity, how it's been utilized thus far and where it's at currently and what the metrics are going forward. What can you tell us about Utah's current ICU capacity? And obviously the trend line over the last couple of weeks has been alarming, but what can you tell us about the projections around ICU capacity?
Well, are bad in one sense. The legislative leadership, and I wasn't aware of this till just recently, has looked, someone's shown them this buried chart on the state DOMA website that few people have access to, that pulls together all ICU beds. Well, an ICU bed in the Uinta Basin is great for those folks, but population is so scarce relative to the Wasatch Front, it doesn't do much good for someone here. As a practical matter, the more complex cases are going to come to the University of Utah, IMED, Dixie Regional, Utah Valley, and McKay-Dee. And those centers of excellence, St. Mark's and a few others, those centers of excellence, ICU beds, are the valuable ones. Those are the highest intensity. They're staffed by nurses and doctors who have terrific experience. So those beds are nearly at capacity. And we have, do we have other capacity? Could we stand up other beds? Certainly. But beds don't treat people, doctors treat people. And so the answer is, we're up against overwhelming our system, and particularly overwhelming our professionals.
We have a couple of questions that have popped up here in the chat room. Let me start with Erin Welch from Highland City. It looks like she's got two questions in one here. What's the best way to address the errant claims of doctors being forced to put COVID on death certificate when it wasn't? And then the second question is what's the best way to address the validity of the COVID test and some of the challenges we've had around testing? So I'll let you take those. And then there's one other question before we move on to Wayne Bradshaw.
Sure. So I guess I don't understand the issue with death certificates. Doctors being forced to put that on a death certificate. I would need some more elucidation on that. I mean, I think they're showing cause of death, pneumonia, pulmonary, whatever, heart, but I don't know that even if they put the COVID, I don't know what the negative implication is that. I'm sorry. What was the second
Gotcha.
question?
The second question was just the validity of the COVID test. We've had some challenges there on testing.
Yeah, there have been some false negatives. In people who are symptomatic, though, hospitals are admitting them and treating them according to their symptom. And for instance, former Governor Huntsman had false negative or two, but he was treated according to his symptoms. So if you come in without sense of smell, without sense of taste, difficulty breathing, oxygen shortage, you're going to be treated as though you had COVID regardless of your test. And they will test you, and if it comes back and you have blue toes and it's negative, they're going to test you again. But by and large, these tests are reliable, way over 95% correct correlation. So we're getting better at it all the time, but they're still pretty valuable and reliable.
Perfect. And then the last question comes from Dennis Clough in Clinton. And it's a technical question around the mandate to wear masks. Is that mandate, would it be intended just within buildings, or would it also include being outside?
Well, it's not intended to be outside if you're not around people. The better stated rules are if you cannot socially distance outside, then wear a mask. So if Cameron and I are meeting for lunch on a picnic table, we can sit 6 to 8 feet away. Probably no necessity to wear a mask. In fact, that's how we're having any social contact at all. We will meet friends or family in a park or in a backyard and maintain social distance. I'm a little vulnerable, so I wear a mask pretty religiously, but most people would be safe that way. But in a building, probably you're going to wear a mask just because of contact, less air circulation, and it's not that inconvenient to do. It's a signal to everybody, and I would suggest within buildings normally we'd wear masks.
Terrific. Well, thank you, Greg. Erin wrote a follow-up about. She said, we hear some conspiracy type theorists claim that doctors are being forced to put COVID on death certificates, even if the individual's tested negative. So I guess maybe right now for you, it's being aware that that's out there, and that could also be helping to cloud the overall message.
I will mention that to my chief medical officer group.
Perfect. And one other question came in from Mayor Peterson down in Leeds about the original guidance of not wearing masks, and pointing out what the shortfall could have been had people gone out and bought masks then, and wondering if confusion from that original guidance may be causing some of the pushback now.
Yeah, certainly we had a faltering trumpet giving the news, right? I mean, they said don't wear them, et cetera, but that's a long time ago. In the life of COVID, that's 90 days ago. Who can remember 90 days ago? And, we have this Goldman Sachs study. I'm happy to share it with you. It is just the last word because it's a trade-off between an economic shutdown. And they're showing that you can take a 1.6 infection rate down to 6 over a matter of a few weeks. So if we wear masks, we can dodge the bullet. We can make Utah safe again. We're going to have to wear masks for quite a while, but it's so much better than sending everybody home, shutting schools down, universities, killing restaurants. We can live with COVID with masks.
Terrific. Well, thank you, Greg, for your time today, and we'll continue to be in touch here as we tackle this challenge.
Thanks.
You mentioned
It's an honor
how.
to be with you. Thank you so much.
Yep, you're very welcome, and send us the materials, and we'll share them out with our network. You mentioned how 90 days feels like an eternity in COVID. Wayne Bradshaw, how many different Treasury Department guidance and documents have we seen in 90 days? The rules around the CARES Act have shifted dramatically during that time frame. Our objective here is for Wayne to give you an update on the most recent guidance. And one thing I'll say before I turn over to Wayne is that as Wayne and I have been in communication with the congressional delegation, we've been highlighting to them the problems with the ambiguity in the law and the shifting guidance, and urging them in a fourth bill to address some of these inconsistencies or ambiguities. And thus far, every member of the delegation has been very responsive to that. So with that, Wayne, I'll turn it over to you to give us an update.
Thanks, Cam. I will go ahead and share my screen. So as everyone is aware, or if you're not aware, the Treasury did issue new guidance on July 8th in their FAQs about what you can use your CARE funding for within your cities and towns. Under the highlights, you can use your CARES funding for matching requirements under the Stafford Act. So if you are applying for any type of FEMA assistance that requires a match of some sort, you can use your CARES Act dollars for that purpose. You can also use these funds for marketing your convention center or your tourism economy. I put an asterisk there because you do want to go and read that guidance. You can use it to market your convention center or tourism economy and the things that they have done to make it safer for you to come and visit or utilize those facilities. You cannot use those funds for coming up with a plan to do these types of things. So I would make sure and take a look at that guidance and make sure that whatever, if you do use the funds for that, you're following the guidance in the FAQs. There was also an additional clarification about using the funds for payroll expenses. As in the first draft of the FAQs, it said that you could use CARES Act dollars to cover the compensation for public safety, public health, healthcare, human services. And this just further clarifies that you can cover the full compensation of that employee that is substantially dedicated. Or you can pick the option if some of you are tracking the specific time in which an employee is working on COVID-19 related efforts. You can pick that track and cover those expenses with CARES funding, but it tells you to pick one or the other. So you're either going to just assume and cover the full compensation, or you're going to track specific time for specific employees. So that is on page 9 of the new guidance. So we've had quite a few inquiries about what I call the Arizona model. So in the state of Arizona, what they are doing to give money to local governments with their CARES funding, in part what they're doing is asking a municipality if how much their public safety compensation amount is in the fiscal year, and between March sorry, not the fiscal year, but between March and December 30th. And then they are sending them that amount of money to cover that public safety compensation. And here's why. On page 1 of the FAQs, it's saying that you can assume that your public safety employees are substantially dedicated to COVID-19 efforts. And then on page 9, with the further clarification, it's saying you can assume that you can cover the full compensation of that employee, of the public safety employee. So what Arizona is doing, and as you can see that other states or municipalities have chosen to do that as well. So Idaho, Wisconsin, Michigan, and the city of Las Vegas. And I'm sure there are other communities that are simply saying our budget is for public safety is $1 million. And so we're going to send, the state of Arizona would send that municipality $1 million to cover that compensation. We've had a lot of questions from cities around the state of, can you do this or should you do this? You know, one of the challenges that we have is we're not on the hook as league staff. We're not on the hook if these dollars are misappropriated in a couple of years when the Treasury or the federal government comes back and says you have to repay these dollars. And so we've basically taken the Treasury guidance. The first question in the FAQs is, do we have to send our expenditures to the Treasury for approval? And their response is, governments are responsible for making the determinations as what expenditures are necessary. And so, you know, we recognize the challenge, but we're also, as league staff, not necessarily in the position to make that call. And so we're encouraging you to look at the guidance and make that call yourself, as well, to help you make these decisions as maybe as a group, or have dialogue within with cities or with the league itself. There is a form, a Google form, which you can fill out that talks about how you've decided to spend those dollars and your best practices. We sent those links out in the June 26th Friday Facts, and I'll also link them in the chat box here in a second. But basically, you can go in and you can say, we're spending the dollars this way, and this is how we've gotten to that conclusion. You'll also have access to the form that everyone is filling out, so you can see how somebody's chosen to do that. You can contact that city and have a conversation about their process or their form. And it is also a spot where we as the league staff can look at different uses and have further town halls and discussions amongst the group about, and invite those cities to come on and talk about their best practices. So we'd encourage you to look to those forms and complete them, and also utilize them to see if cities are adopting the Arizona model and asking how they do it. You know, a lot of the guidance talks about during the COVID-19 health crisis. And I think a conversation we should potentially have is, if you're in green, are you still in a public health crisis? And would this covering your compensation count? And so those are the kind of conversations we'd like to continue to have. So we'd encourage you to fill out this form. And that is, we're happy to, Cam, do you have any comments?
Wayne, you got a couple of follow-up questions here from the US 40 corridor. Heber and Roosevelt, both asking substantially the same question about the term substantially dedicated, which to my knowledge has not been defined within the Treasury Department guidance or FAQs, correct?
That is correct. There's no definition what substantially dedicated means. And so to Cam's earlier point, we have asked the federal delegation to help try and clarify some of these questions and provide definitions in further legislation.
In fact, on Friday, I was chatting with a senior staffer in Senator Lee's office and pointed out the difficult spot that you find yourselves in as cities, where you are trying to interpret the will of Congress through the Treasury Department with rules that change every 2 to 3 weeks. And they were very receptive to that. And so as we get this Google Doc filled out, we will in turn share what we're seeing with the delegation, because nobody wants a scenario where you operate in good faith today, only to have the Treasury Department come back a year or two from now and audit you and seek a clawback of those funds. And every member of the delegation with whom we've communicated thus far agrees they don't want that situation either. Wayne, question here from Mayor Reese in Cedar Hills about the direction for cities who contract with another city for these types of services. So this is the sub-grant concept.
Yes, so once you receive those funds, if you're in a special service district or you contract them out, if you choose to cover those expenses, you can do that. You know, ultimately, you sign the contract with the state of Utah, and so if any of those expenses are null and void under a federal audit, then you would have to pay those back. But yes, you can subcontract those dollars to services that you're receiving, as long as it follows the Treasury guidance.
Yeah, but if Mayor Ken is on here from North Logan, he asked a similar question a few weeks ago, and I answered it then by saying that his Lone Peak, or not Lone Peak, that's you, Mary's, but the North Park Police Department could not be a direct recipient of CARES Act dollars. So in other words, the federal government cannot send that money to the special district, but North Logan City or Cedar Hill City can subgrant that money, which anonymous attendee, I always worry about questions that come from anonymous attendees, but it's the same concept here, that if you give the grant and the money ends up coming back to the city's revenue, as long as your original grant is consistent with the Treasury Department guidance, then you should be okay. Now, Wayne, I've got a great question here from the Grove That Is Pleasant. Scott Darrington is asking about the involvement of the state auditor. And this is the tricky thing that you and I talked with Congressman Curtis about last week, about the role of either the state of Utah or the two counties in auditing or administering federal funds.
Yeah, that's a great question. So the governor's office and the legislature invited the auditor's office in to help do kind of the reporting of how cities and towns that receive funding from the state utilize their dollars. And so if you've received funding from the state, you are required to then go on and on the auditor's website, put that information. That is the reason the auditor's office is involved. If the auditor's office choose to review and look at those things, that's obviously within his purview. But I will say, come to January 1st of 2021, if the auditor's office says a municipality misspent those dollars and we should recall them, those dollars don't go back to the state. Those dollars go back to the Treasury. There is no value for the state or the state auditor's office to come back with a critical eye and try and recall dollars that you have spent within your communities, because if they do, it goes back to the Treasury. It does not go back to the state of Utah. And so to your question, I don't think there's a lot of value for the auditor to come in after January 1st and be critical and try and ask for these dollars back.
Scott, this is one of the issues we've brought up, though, with the delegation, both at the state side and the county side. It's just better clarity of what the role is for the state auditor. Yeah, that's something that Congress could accomplish in a fourth bill, even if they choose not to allocate an additional dollar. They could just use a fourth bill to better clarify the CARES Act. So the more info we can gather from you of how you're using the CARES Act, then we can make sure that that's all considered to be approved if Congress decides to revisit the CARES Act. At this point, as we've talked to the delegation, we've gotten mixed signals over what will or will not be in a fourth bill. Wayne, any other thoughts on your end? Oh, and actually, before we do that, Mr. Downs from good old Orem City, the O-town of Utah County, has a question of if it's in the state's power to put in additional restrictions or make interpretations, and that would go for the county as well.
So there is an FAQ where they ask that if state or whoever is subgranting dollars out can add additional restrictions. And the Treasury said the only restrictions you can apply are the ones to make sure that whoever receives these dollars are compliant with the Treasury, with the CARES Act guidance and the Treasury guidance. And so if the state says or if the Treasury says you can use these funds to market your convention center, the state nor the county can come in and say, no, you cannot do that. The guidance is pretty clear, saying the only additional restriction they can apply is to make sure you're compliant with the CARES Act and the Treasury guidance.
Perfect. Thank you, Wayne. While we wait to see if any other questions come in, any other thoughts on your end about how cities in the next few days should interact with the delegation? You worked for many years for Congressman Bishop, and so any just words of advice on how to be efficient with the message that they heard from the national leaders today in this conversation about the CARES Act?
Yeah, having worked for a member of Congress for 7 years, I think when you have a request, you need to be specific about what you want. Do you want additional flexibility? Do you want additional funding? Do you want direct funding to you as a municipality? I think you need to be prepared to state those things and why you think they're important. And NLC has a lot of great information. We have a lot of data about the sales tax impacts, and we can help you get more specific data if you would like us to as well. But be specific about what you're asking. Don't say we need more help. Be specific about what that help should be.
Terrific. Well, thank you, Wayne. Thanks for all of your work leading out on the CARES Act. Again, please use that Google form. It'll be in our follow-up email, but it's in the chat box about how you are contemplating using the CARES Act dollars. Everyone should have received the first tranche by now. If not, let us know. And then the conversation will continue throughout the year about additional funds and resources. So with that, that is our Economic Impact Town Hall. At this point, we do not plan on one next Monday. We're planning to go every other week unless something urgent occurs between now and then. One thing I'll note is that the governor's order expires next Friday, and that order currently does not have a statewide mask mandate. So 2 weeks from now, when we meet again, we could be under a new framework, or it could be a continuation of the status quo. He has targeted August 1st as the time frame where we need to lower the case counts in Utah. Congress resumes next Monday, so please take advantage of this week while Congress is on recess, and here in the state, follow up with their staff members and follow up with the actual members, and then things will get crazy a week from today when they fly back to Washington, D.C. So with that, thanks to everyone for joining us today. Holler if you need anything else. Remember, government closest to the people governs best. Thanks for joining us.